Hello, everyone, and welcome to the UQ Biotechnologies Society's Revolutionising Healthcare Through Innovation panel discussion. Now, this is one of the coolest events we've had in a really long time because it's an event that is situated in a very different field to what the Biotechnology Society normally runs their events. The Biotechnology Society in the past have run lots of really cool events on the technological aspects of biotechnology and really going into the theory of biotech, the industry of biotech, who's hiring within the industry. But I think this is a really cool innovation panel because it shines light into the startup world in biotech and how you can really embrace innovation and your entrepreneurial spirit to commercialize an idea with the end goal of helping people within society and really making that positive impact for all the people within our society through healthcare. And I think now is probably a better time than ever to really have these type of events that shed light on our healthcare system, because with the recent pandemic, with recent inequities that have been identified in the current healthcare system, we're in a unique position now as a society to help address some of these problems and challenges that have systemically been facing a lot of people, particularly people with disabilities, people from marginalized groups, or people just without access to basic healthcare services. So I'm really, really excited to be having this panel discussion today, and it wouldn't be possible without the help of our collaboration with the University of Queensland Pre-Medical Society, the Association of Biomedical Science Students, and UQ FinTech, UQ Innovation and Entrepreneurship Society, and UQ Engineering World Health. And I think that by having such a wide range of societies to collaborate, we're really getting people involved from all these different sectors, because the healthcare scene shouldn't only be really isolated to people in the healthcare sector. I think that there's really unique opportunities for people from various backgrounds, whether it be engineering, science, arts, the legal background, to really.
Have you ever seen that TikTok where it's like one for hydration, one to keep awake, and one for fun?
Yeah, I think it's really important to have people from multidisciplinary backgrounds to be involved in the healthcare system, to really start to push innovation, because you'll never get anywhere if you only hear the same viewpoints, or if you're only constantly reiterating views that are learnt in a specific field. So I think it's very, very cool to have people from such a wide audience here in this event today. And before we get started with the event, I'd like to first acknowledge the traditional owners of the land that we're currently on. So I'm currently sitting here at UQ. So I'd like to acknowledge the Yagara and Turrbal people of UQ and their spiritual connection to the land, but more so the continuing influence that they have on the healthcare systems within their own community, and within continuing to spread messages of accessibility in healthcare. I have very close personal friends in Jara and Ungura Harbour. They are Indigenous medical students who are really looking to improve the accessibility of healthcare within Indigenous communities, especially here within Brisbane, but also central Queensland. And I think it's really inspiring to see how there are lots of young people really wishing to help innovate the healthcare system and help improve accessibility, which is what this whole event is about. So I'd like to shout them out for the hard work that they're doing, and also like to acknowledge the traditional owners of the land that we meet. But without any further ado, I'd like to move on to our all-star panel. So this is a panel that the Biotechnology Society has never seen before, and it's really, really amazing to have James Fielding, the CEO of Audeara, Clair Sullivan, the head of the Queensland Digital Health Network, Jeremy Hunt, the CEO of the VacSeen Project. So I'd like to first introduce you all to James Fielding, who will speak a little bit more about who he is, his journey, and his time at Audeara.
Hi, everyone, and thanks for having me, Vish. When it comes to giving a little bit of background about myself and the team that we've built, it probably is important to go back to the early days of UQ. So when I started at UQ, I couldn't pick between business or medicine, and was lucky enough to have the opportunity to do both. So I did a business degree, a science degree, went across and worked in New York for a while in a hedge fund, worked for a guy named Harvey Weinstein for a while, won an Oscar, worked in a casino in Vegas for a bit, came back and did medicine at UQ, and was fortunate enough to get a scholarship to do the medical leadership program, which was an MBA alongside medical studies. And at the graduation of medicine and our MBA courses, started a company with a buddy of mine that I've been doing this medical leadership program with, called Chris Jeffrey. And we started Audeara, and at the same time started Field Orthopedics, Yum Confectionery, Robotics Engineering Research Laboratories, and RER 360. And a few years later realized we couldn't run 5 companies at once. So I started focusing on Audeara, and we grew that from a concept trying to address access to hearing health information through to being now Australia's leading non-hearing aid device sold throughout audiology clinics that focuses on returning an entertainment and communication experience to all people, regardless of their hearing ability. I'm using them now. We make Bluetooth noise cancelling headphones with a built-in hearing test. You put them on, you do the test, and then we change the way the headphones sound based on your individual hearing profile. We're now available for sale in every audiology clinic in the country, which is super exciting. And we floated on the ASX around 12 months ago. I just got back from 3 months in the US launching the product over there, and have really had the opportunity over the last 6 years since leaving medicine and that graduate leadership course, being able to explore a whole range of fields and a whole range of opportunities, which give me a lot of joy in coming back and talking to people and meeting equally like-minded entrepreneurial spirits who come out of UQ and, you know, take me out to lunch and ask them all their awesome questions and tell me about all of their amazing projects. And I genuinely believe that in Brisbane in particular, we have an incredible ecosystem filled with some of the brightest minds on the planet, and we have every opportunity to make that success here. So I'm happy to answer any of your questions here, but also hit me up afterwards, because I really enjoy getting in touch with people in real life. And that's me.
Yeah, awesome. Thanks, James, for that introduction. And it's really great to hear all of these words about how strong the Brisbane startup ecosystem is, and how your degree, especially in medicine, and your earlier degrees have really empowered you to go down this route of really making a transformational difference. So thanks for that introduction. And next up on our panel, I'd like to introduce Clair Sullivan. So she's the head of the Queensland Digital Health Research Network, and I'll let her talk more about what she does and the impacts that she's having on healthcare outcomes.
Thanks very much. I must admit, talking about myself is one of my least favourite activities. So I'm an endocrinologist at the Royal Brisbane and Women's Hospital. I'm the head of the Digital Health Research Network at University of Queensland. I probably won't say too much more than that, other than I'm absolutely privileged every day to go into the Royal Brisbane and Women's Hospital and look after people who are in the most desperate of circumstances with the most dire problems. And every day they teach me resilience and kindness. And so really my aim is to use the technology and digital ecosystem to improve their lot. So I look after about, I think it's 50 researchers now, 12 PhD students. We have direct translational pathways straight into Queensland Health and also into the health system nationally. So it's an absolute honour for me to be here today and to hear from you all, and hopefully I can help.
Yeah, wonderful, Claire. And it's really great to see that you're on the translational side of all of this research, which I think a lot of people, a lot of our members are really passionate about pursuing that translational research and what they can be doing behind the scenes to be improving patient outcomes. I think you're in a unique position to be seeing both sides. So it'll be really great to have your input on today's panel. And finally, I'd like to introduce Jeremy Hunt. He's a current third-year University of Queensland Doctor of Medicine student, and he is the CEO of the VacSeen Project. He also is the Brisbane's Young Citizen of the Year. He was awarded Brisbane's Young Citizen of the Year at the Australia Day Awards recently. So welcome, Jeremy, and I'll let you talk a little bit about yourself and the initiative that you've started up.
Thanks for that, Vishaak. And an unnecessary shout out there, but yeah, appreciate coming along and being able to chat, because I think I'd be equally as excited to be able to just come to this event and hear James and Claire speak from the other side rather than just being on the panel. So yeah, it's pretty cool to be alongside them today. We started the VacSeen Project, myself and 6 other uni friends, at the very end of 2020. We pretty much found out that a clinic in Brisbane was struggling to afford to purchase flu vaccines for about 200 of their patients who are experiencing homelessness, just because those patients weren't covered for a free flu vaccine, and the clinic had quite a tight budget. And so while they could provide vaccines to people who are over 65 or people who had a pre-existing medical comorbidity, there was a group that didn't fall into that category that they just couldn't help out. So we started off by kind of just getting together with the aim to raise enough money to buy those, I think it was 200 vaccines that we originally bought. And that was just through community fundraising. And then later in 2021, we had a couple of organizations reach out who'd heard what we'd done with the flu vaccines and with Inclusive Health and Brisbane Youth, and kind of said, hey, do you guys do any COVID stuff? And at the time, we certainly didn't do any COVID stuff, but what we did said, let's try and do something, and came together and ran a few small pop-up clinics where we just took out the COVID vaccines in Little Esky, set up alongside a homeless shelter or a service, or in a boarding house, for example, and delivered vaccines there and then. Since then, now we've run, I think it's over 25 or almost up to 30 pop-up COVID vaccine clinics. And that's been across Brisbane and Toowoomba, Sunshine Coast and the Gold Coast. And we've also been lucky enough to partner with Queensland Health this year to run a pilot program where Queensland Health are covering the cost of free flu vaccines for 10 clinics, including ourselves. And so that's just getting off the ground now. And I think the first vaccines are just going out of the warehouse to those partner clinics and ourselves this week. So it's been a pretty wild ride from where we started, and I don't think that we ever thought we would be doing what we're doing now. But yeah, it's been super, super cool, and I hope to learn a lot from James and Claire today, and hopefully pitch in with 1 or 2 things from my end as well.
Yeah, awesome. Thanks for your introduction, Jeremy. And I'm sure everyone's going to be really keen to hear some of your insights being a current student and how you're using your position as someone who's quite young to sort of help transform the field. So just for everyone in the audience today, the way this event's going to run is if you have any questions, and I'd highly encourage you to ask anything, nothing's really off limits here, just message in the chat and we'll get to your questions. And I do have a few pre-written questions just to ask people and questions that were submitted to me beforehand. So yeah, whenever you guys have any questions or if you want to have any follow-up discussions, feel free just to put it within the chat and then we'll go on to answering these questions. But yeah, I guess the first question, and this is something for all 3 of you on the panel today, is you all have a very unique position in solving a problem in healthcare, right? So with James, it's about solving the issue for people with hearing disabilities. For Jeremy, it's solving the inaccessibility of flu vaccinations to homeless people. And Claire, you're doing a lot of research on the digital health and translational aspect of things. And I recently heard from a student, a biotechnology student, that they are passionate of getting involved in the entrepreneur sector, but they're only really at like an undergrad or like 1st or 2nd year level, and they don't really know what problems are out there to solve. So how did you all go about identifying problems that needed to be solved? So I guess sort of start with you, James.
Yeah, sure. So I was, as I said, I was fortunate enough to live a little bit before I came back and did medical school, and was also placed in a room with some very interesting people who came from all walks of life. So My co-founder, or one of them, Chris Jeffrey, who I mentioned earlier, was a robomechatronics R&D engineer for the military who was bunking with a trauma surgeon on deployment and said, what you do is more interesting than what I do, came back and got into medicine. So he was looking at using robots and using systems and using databases to try and solve medical problems while we were still medical students. But the impetus was from our work in the hospitals. So going from the early years of medical school into the clinical years, you're faced with the realities of a hospital system. And as Claire knows all too well, you see people who fill you with this sense of resilience and strength and optimism. And an awful lot of the time, it's their capacity to overcome not only their health condition, but all of the logistics and infrastructure and coordination that's involved with getting that world-class care. And so you see, if you look past the clinical, you see all of the systems that are around a person seeking care. And for us, our particular use case for the headphones was ENT clinics needing an audiogram to make an assessment regarding a potential surgical option for a hearing loss. And the time to see the ENT specialist was 3 months, and the time to get the hearing test was 12 months. And you're looking at a person sitting down and saying, can you hear this beep, yes or no? To get a pure tone audiogram, it is a very simple piece of information. And you have tertiary trained professionals who have skills in allied health assessments, home care assessments, communication techniques, speech impediments, whatever it may be that is impacting a person's capacity to communicate with the world around them. And they're sitting there pushing a button and saying, can you hear this thing beeping or not? And it takes up the majority of their time. And so we thought, let's see if we can solve that tech problem and create a device that goes beep to give people this audiogram. But then in understanding that we could achieve that, which is a fairly technically straightforward exercise, the real impact we wanted to make was in going deeper and deeper and deeper into the rates of hearing loss, who it's affecting, the links between depression, Alzheimer's disease, lots of different phases of social isolation. And it all stems from the stigma associated with hearing loss and people not wanting to take action. So it became a transition in our need case from saying, hey, there's this technical thing we should have a look at, and then getting interested and excited and exploring it, which unearthed all of these other problems we could start solving. So in terms of being an undergrad or not feeling like you have enough exposure, these things are all real. They're all real concerns, but you need to find something that's going to make you want to take the next step. Like Jeremy did with his clinics, like Claire is doing with access to, what we consider to be very sort of simple infrastructure techniques. And we need to understand why these things which seem easy aren't being done. Seems to be a good step we found in trying to solve a problem, going, surely somebody's doing that. And then you find that they're not. And you can say, okay, well then, instead of waiting for someone else to build a whatever, or waiting for someone else to solve it, you don't sit around in the tea room complaining about the problem. You say, let's go and build a solution. And the first step is often wanting to build that solution, because you'll find that even though you think somebody's already done it, or it may not have the impact you want, the fact that you want to do it and the fact that you think it needs doing means it's a great opportunity and you should take it.
Yeah, that's awesome. Thanks, James, for that advice. And I know a lot of people watching would really take that on board. But yeah, moving on, Jeremy, what would you say? would be your journey in trying to identify problems, or what people could do to identify problems that need solving?
Yeah, I think that for us, it was a little bit less of looking at a grand scale and thinking, oh, what's the fundamental problem that we can solve at the beginning? Because big capacity and in different areas. When we started, like I said, it was just kind of that one small thing that we found out, that one clinic couldn't provide a service to a group of patients who ideally they were the ones that the service should be provided to the most easily, because they were the highest risk. And just kind of like James said, it was something that we thought was so simple, but something that there was just this gap, and something that we could do something about it feasibly. And then I think since then, in terms of us running now these pop-up clinics that are kind of GP and med student or student volunteer run, it's just been a matter of being in the space and having the connections of different organizations that we've been working with. And they're the ones who are with people experiencing homelessness every day, or the marginalized groups in other areas that we also work with. And they're the ones who've been kind of saying to us, oh, you guys have a little bit more health experience.
Jeremy, sorry to interrupt, but if you can hear me with that, your internet is just cutting out a little bit.
Okay, I might be able to hotspot. I don't know why that's happening, but I'll sort that out. Sorry about that. I'll finish up before I go and get the hotspot sorted, by saying that I think that for us, at least while we're at uni, we wanted to do something that was small but would have a really positive impact. And I think that if you can find a small issue that you can directly do something about, then it can directly be parlayed into something bigger. Because if there's an issue that exists in one place, it's highly likely that it exists more broadly, or it can be applied more broadly. So like for us, the initial thing was the flu vaccines for one clinic. Where we are now is health access for people who don't want to go to a GP clinic, or who don't want to kind of access health services in a traditional manner.
Yeah, awesome. Thanks for that, Jeremy. And then, finally, Claire, would you like to share your insights and learnings from identifying problems within the healthcare sector?
Yeah, I'm not sure I am going to help you with any entrepreneurial insights there. That's not really what I do. So, but what I can say is that as a researcher and a practitioner in digital health, I'm not particularly interested in point solutions. That sounds terrible, doesn't it? But I'm not. I'm interested in changes at scale and changes to platforms and the way we deliver care. So system change, the way that we think about healthcare and how we deliver it. So some examples might be putting in an electronic medical record across an entire hospital. Now that's a problem that needs a solution, and it's hard. How do you do that the best? What's the best way to do it? Some examples of recent work we've done with the government is, how do we look at the digital health maturity of all of our hospitals? How do we assess them, and what should that investment pathway look like to deliver the best outcomes for the best investment? So these aren't necessarily entrepreneurial small problems. I love the way Jeremy described them, and that might be of more interest to your student audience, but I guess perhaps I'm showing a different way to make a difference. And that is, I'm probably what you call an intrapreneur, right? Rather than an entrepreneur. So part of the system, so that the problems are very obvious, and we are actually tasked with solving those system type issues at scale. So I'm not trying to make a millionaire out of myself with any particular product, I guess. So I'll be a complete failure in that criteria, but I'm okay with that. But we are creating better outcomes for consumers at scale across the system. And so an example of that would be putting in the electronic medical record at STARS. We've just finished that work, and we're showing a 40% reduction in medication errors immediately. Now, I don't know of any other single intervention that drops adverse events so quickly, other than potentially hand washing. So these type of large infrastructure platforms have the potential to just dramatically improve consumer outcomes. They're not entrepreneurial, so I've failed that box, but they are really impactful in terms of the way that they improve patient outcomes, system outcomes, and experience for our consumers and clinicians.
Yeah, that's awesome, and really great to hear that unique point of view, because I would disagree in saying that those are very entrepreneurial things inherently, creating new infrastructure, which I would.
But when I talk to the business school, they just look at me funny.
But they look at everyone funny. That's what they get paid to do.
So it doesn't kind of fit that 1990s entrepreneur model that's widely promoted. But I wouldn't be surprised if many of the students that are on this call actually end up working for large organisations, end up identifying problems within those large organisations, and are then trying to work out how to get the resources within their envelope, within their governance pocket, to make a difference. And so that type of entrepreneurialism is just as important as private spin-off companies, because it does have the ability on the ground to create really tangible outcomes for consumers and to use the public dollar to the best ability. So I know it's not cool, but it really does make a difference in my view.
But Claire, you're an endocrinologist, aren't you?
Yeah.
Yeah. So you could just go and do diabetes medication every day if you wanted to, right?
Yep.
And I think that's a huge part of the people listening when we talk to other panels. You know, being a health professional now, I think, even from when, you know, what we were doing 10 years ago, starting this MBA stuff was, oh, that's pretty interesting. But nowadays, this notion of, I go through medical school, I choose a specialty, I put on my specialty hat, I go to the hospital, I swipe my badge, I write my scripts, I go home. I hope that is becoming less and less common, because people are starting to approach their work and approach their system and think, how can I do more than I can with my own two hands, right?
Yeah,
Which is
you're probably right. Stuff. You're probably right. But the system's not geared up for that. So if, for example, I'm from a long list of, my family's been medical people for about 5 generations. And so there's complete horror that I am not on Wickham Terrace. Complete horror.
Well, you're a family letdown. Imagine
I am a family
thousands of people a day rather
Correct.
than
so I could be churning through the metformin scripts, probably making 3 or 4 times the amount of money that I'm making now. However, that's not what motivates me, and I would be sad. So I take very much less pay, but I feel every day that I'm changing outcomes for better, and that the impact of my work, although quiet, will outlast me. So I would, whenever I speak to the medical students, and I'm speaking to them again, is to talk about what motivates you, what actually makes you happy. And working in the public system and being able to apply evidence-based, rigorous approaches to quality improvement is a really satisfying job. So for any of the students out there who are interested in that, I know it's not, you know, kind of portrayed in a very positive light, but to me, it's been a really satisfying career.
Yeah, that's awesome, that discussion. And yeah, there's a few questions coming in the chat. Before we go on to those questions, I thought I'd use this as a perfect segue into a question that had been requested by some of our members beforehand, which is specifically directed at you, Claire, is where do you see the healthcare sector going within the next 15 years? And how do you think aspiring doctors, engineers, biotechnologists, scientists, or people just aspiring to go into the field of healthcare can upskill themselves to keep up with these trends?
What a great question. So 5 or 10 years ago, we needed builders. So it was system naive. So essentially healthcare was an artisan type industry with individual specialists delivering bespoke care. And so it was relatively easy to come with a technological innovation at that point, because the ecosystem was naive. So you could bring in an app or a software program and no one would squeal because it was a blank slate. Over the last 5 years, in Queensland alone, over $500 million has been spent in digital health infrastructure in public hospitals. 70% of all public health care is now delivered on a single electronic medical record. So if you build an app now and come in, it is going to clash. So rather than builders, we now need renovators. We need people who are absolutely up to speed with the current digital health infrastructure. They understand the platforms, they understand information flows and current clinical workflows. And they are able to leverage this large monolithic infrastructure into low code and no code solutions that creates innovation and improvement at the bedside. So I think it's a shift that I don't think the industry is necessarily caught up yet, how sophisticated current infrastructure is over the last 5 years, massive investment from governments. So you can no longer come in naive with the digital health innovation and expect it to be adopted. You need to think about renovating what's already there, low code, no code, integration. And I don't think that advice has necessarily come through. We're still teaching people hackathons, imagine the problem as though it's happened, imagine how you're going to solve this problem without necessarily informing or understanding the extant infrastructure. So if I could say anything, it would be, we are now so sophisticated, you need to understand what the infrastructure is before you innovate.
Yeah, that's awesome. And I think right now, it's not necessarily, we're not really living with a healthcare system that can just be changed overnight, right? So I do think that like building a whole system up from scratch would be extremely difficult. And yeah, 100% agree that we do need these renovators. But yeah,
we need the renovators. Where are they? And part of the problem is the renovators don't have access to the infrastructure. They don't understand what it is. And they get quite miffed when they come in with their piece of software that they've built. And everyone just goes, well, how does it integrate with Cerner? So how is that understanding going to be promulgated? How are we going to make our innovators more sophisticated and more knowledgeable about the extant infrastructure that's already there?
Yeah, and I think that'll be a really key piece of learning or teaching, especially at universities in medical programs, also in biomedical.
Yeah, so we've taken that, some of you may have seen, we set up our graduate certificate in digital health, started last week. So this is a program sponsored, so I received some funding from the Digital Health CRC to set this up. It targets 3 streams of people, so clinicians who want to work in digital health, IT and engineers who want to work in healthcare, and healthcare leaders who understand that digital health is the most powerful tool they have for system improvement. This is a multidisciplinary program across School of Business, School of Medicine, HABS, ITEE, Science, Maths and Physics. And it aims to actually start to develop an understanding of what the current state of digital health is, how to innovate, how to deploy new models of care, and the type of change leadership rather than change management that's required to deliver change in healthcare. We already have over 30 enrollees, and Metro South has just bought part of the course as well to deliver to their Metro South clinicians. So we're really excited about it.
Yeah, awesome. And yeah, I'd like to move on to the next question, which is one of the ones that Harsha brought up in the chat. So this is directed to James. So given your vast journey to where you are now, what are some of the setbacks you've experienced and how did you overcome them? And also, what are some of the barriers that people do face going into creating their own company in medtech?
I love these tiny little questions. So looking at some of the issues we've had, it almost helps to categorize them based on what people want to know, because it's the barriers and the challenges are endless. So I think it is a mindset of, and it's something I've been trying to tell my team as well, and something that I've been able to communicate in different sessions recently. My life is amazing, but my job is really hard right now, is a way that I try and compartmentalize and, exercise, meditation, healthy, like all the basics of kind of a bedrock of I want to be an effective person, help you deal with all of the ups and downs. But by way of just kind of a string of anecdotes, I suppose, to provide some layer of context to this, when we came up with the idea for the headphones, we wanted to originally just sell the idea to Jimmy Iovine and Beats and make a stack of money and then go back to being doctors and kind of get on with our day. But then we built the tech ourselves and got really excited about the idea of manufacturing our own product and making it to spec and having control over the development process. And we had this kind of inventor's dilemma of wanting it to be really good, but we didn't have the funds on hand to do the manufacturing. We raised a bit of money through networks and, you know, luckily enough to know people who were willing to sit down with us, and we raised a couple $100,000 that way to essentially pull me out of clinical practice and keep a team afloat to build the headphones. We then did a Kickstarter campaign, which is where you throw your idea up on the internet and see if people want to buy it in advance to help fund the realization of it. And in preparation for that, which was around 6 months work, the night before we were supposed to launch, after telling everyone March 1st, March 1st, March 1st, March 1st, the system crashed and our site was deleted. And we were on there, you know, doing a final midnight check to make sure it was all looking good. And it just went blank. And we had this error email from Kickstarter going, "Hi, sorry to let you know, we've had a server issue and everything's crashed." So we had to rebuild that overnight, and we had people there. And you've got two issues that you can sort of attack when there's a problem. And it's something that we learned in my personal experience in emergency departments and all this kind of stuff. Yelling and jumping up and down does not save the person's life, right? If there is a situation at hand, you need to stop, take a breath, analyze what is going to happen, and then do the next thing that is going to be a forward progression. You can yell and scream and cry and drink and feel sorry for yourself later, but at first you've got some problems to solve. And so we rebuilt the whole site, we recoded it, linked it up, sent out all the emails, got it done. And at 5:45 in the morning, we're ready to go live at 8 a.m. And we made $100,000 that first day, and it was very exciting. And then we had to actually manufacture this thing. And every time we wanted to do it, we kept saying, let's just make it a little bit better. Let's just make it a little bit better. So I had told 3,000 people, you'll get these headphones in September, because we launched in March. No worries, we'll have headphones. It's going to be great. Then I have to tell them, sorry, it's delayed. And then it was no worries, they'll definitely be there for Christmas. And then I got told live on stage at some other point I'd ruined Christmas in 60 countries because we missed a Christmas shipment. And then we missed Valentine's Day. And we finally shipped them out March 1st. So 12 months from launching and saying, I'll get you your headphone in 5 months. 12 months later, we shipped 60 countries. Very exciting. Finally got them out from Hong Kong. Half of them went east and landed in the US the next day. Half of them went west and landed in Poland and got held up in Polish customs. And all of our customers were sent emails in Polish demanding Polish crown payments and a copy of their passport to release their headphones. So I went, oh, great. And so we had to tell people, I'm not scamming you. Yes, this is real. We're terribly sorry. So lots of money, lots of sleepless nights, flew up to Hong Kong, trying to figure out what was going on. Finally got them released, and that was great. And then we just sort of ran. And then, you know, they start breaking, or people have issues and go through, and we ran out of money a lot. You know, it's a very expensive business. We did a launch in China, spent a whole lot of money, didn't go as well as we liked. My grandma was paying wages for 3 months and I was going unpaid, having taken over the world and had global shipments, and it was all complete chaos. And then at the start of 2019, I fired everybody who wasn't sitting next to me, and we landed the supply agreement with Hearing Australia into the Department of Health. And we got going and focused on clinics and went laser focused and got rid of all the other distractions and built and built and built and built and built. And the hurdles are never ending, especially when you put yourself out there and you decide to take an opportunity or take a risk. There's always going to be an issue. It's never going to go as well as you like, but you have to have a really strong team. And you have to have an internal metric or an internal compass that lets you know you're doing the right thing. Otherwise, you'll be miserable the whole time. Because especially if you're fairly optimistic like I am and you surround yourself with opportunity, I believe it is going to work. I don't think it's going to work. More often than not, I've got no justification for why I think I'll be able to pull it off. But there is this internal thing that just says, I believe this is going to work. And at the end of the day, my mum still loves me and thinks I'm great. So it's all going to be fine. And it's just money. And it becomes tricky when it's someone else's money and it's someone else's trust and it's someone else's belief. And, you can look at it and think, oh, look, they're just headphones, whatever. But, then there's a few $1 million involved and there's lots of people who said, I really thought you'd be able to do this. You let me down. And it starts to become personal because we made it personal. But at the end of the day, in terms of overcoming these challenges, overcoming these issues, you've got to have someone to talk to about it. You've got to have someone that gets it. And for me, that was a whole string of mentors. And we recently, I think 2 years ago now, started up this fun thing called the Biotech Exec Southeast Queensland Lunch Club, which is essentially a whole bunch of biotech CEOs, and we get taken out to lunch by Google and stuff and have a few drinks and sort of talk about life. But you have to create these opportunities to build and take advantage of a support network. Otherwise, you'll just implode. Because if it's you versus the world will always win. And so you have to believe it's going to work, but you have to surround yourself with the tools and the people that are also going to share that belief. Otherwise, it's a nightmare sometimes. But you have to think it's going to be fine. Otherwise, you'll just be scared every day. And then what's the point? It's supposed to be fun, right? So you got to kind of take that approach.
Yeah, awesome answer. Thanks for that, James. And I guess it sort of exemplifies the saying that whenever you come across a wall, you just got to build a door and get through it. So yeah, I think it's really great to hear that message that whenever you do face challenges, you have to create opportunities and you should always be proactive about it. So yeah, it's really great to hear those words. And sort of leading on from there, I guess I'm sure people would be keen to hear what role you think business and economics plays in healthcare. And I think this question is directed mainly to you, James, but also to you, Jeremy, given that you're running a charity now. To what degree do you still have to be making money to ensure that your charity still has an impact? So yeah, we'll start with you, James, if you're happy for that.
Oh, sure. But I'm also dead keen to hear what Jeremy thinks, because my personal approach across all these different entities is we've always run it as profit for purpose rather than charity. And that's just our particular approach, in that you're making something of value. You can feel justified asking somebody to pay for that. But it works in particular areas. So I'd definitely love to hear Jeremy's approach around the charity piece and how that sort of fits into the system, for sure.
Yeah, well, thanks, James. I think that for us, because of the way that we came about, it was less. We didn't have the capacity, I suppose, because there wasn't really an opportunity to sell a product, and we weren't really going down the route of trying to make this a massive thing from the very start. The reason that we decided to set up a charity in the first place was essentially that we couldn't raise the money from family and friends and be able to collect it and then pass it on, or to be able to collect it and then purchase the vaccines. We wanted to establish it in a way that kind of was all above board and all in compliance with everything. And so that we didn't have, say, the tax office coming to me and saying, hey, we've seen that you've had like 80 people transfer into your bank account, Jeremy, like $50 each or whatever. Can you explain what's going on? And then where the money went to. So we established it for that reason in the first place. But I think that it is a very important discussion, especially around when you're thinking about how to deliver services to those who I suppose wouldn't otherwise be able to access for whatever reason, or if you're trying to solve a problem that affects certain groups of people, because there is definitely different approaches you can take. I think what we've been doing, because we're all still students, because of the way that our clinics run and all of that, it's been a lot easier for us to be a charity, to be able to get grants and to be able to kind of fund it a little bit like that. But there is another organization called Sunny Street up in the Sunshine Coast that some of you might have heard of, that do quite a similar thing in terms of, not specifically with vaccines, but they run a health service for people experiencing homelessness and other vulnerabilities. And when we were talking to them very early on, trying to pick their brains, they set up as a profit for purpose. They were not registered as a charity at all. And the reason that they wanted to do that was because their model wanted to be, we're going to make it a profitable thing for us to be able to deliver these services so that we can then build it up and expand. And for them, it was about doing a good thing while also being able to support their own livelihoods and maybe be able to sell the business on or something like that in the future. So I think it's a little bit dependent on the goals and also at the start, kind of where we were looking to go. But I think that there are some areas that it would be easier to do the charity, some areas where it's easier to do a profit for purpose, which essentially can be the same thing, but it's just a matter of compliance and all of those kind of things. You can get the same outcome with either, but I suppose it's just a matter of how it best fits with the mission and with the funding sources and with the scope of the project. And like, I think for Audeara, they've been able to have such a way more kind of massive impact through being a profit for purpose organization than they could have ever had being a charity, is my kind of assumption from what I've heard James speak about today.
Yeah, I think you're absolutely right. I think it comes down to scale and scope. And when I look at groups in our area who have the charitable approach, I think the potential downside of the charity is that you spend an awful lot of your time and energy and effort raising funds from charitable donors, and it's a different energy expenditure to getting the benefit from delivering the care. And so it's really a use of time and scope. And you'll find that in every state in Australia, there is a hearing health associated charity, and they tend to work in their local area and focus on, they might have a school or a really valuable piece of the community that is theirs on their turf. They have, and they'll have relationships in other areas. But it's also, in terms of business and economics impacts in healthcare, it's kind of everything, right? I mean, at the end of the day, someone has to pay for it. And you need to be able to find ways to fund the care you want to give. I mean, we talk about it and say we have to earn the right to help people because somebody's paying for it. And for us, we have to earn that right, and it's expensive. And when you look at the costs of running charities and all the World Vision stuff, and people get beat up a lot about where do all the funds actually go, because I think there's this misrepresentation that if you're working for a charity, you're also doing it for free, and nobody is, because everybody needs food and everybody needs shelter and everybody needs these things, and it can get fairly complicated when you look at the different mechanisms. But at the core of the question, how does business and economics impact healthcare? You cannot really have one without the other. And I think in the Australian system, there's the veil of it's free, but it's very much not free. It's 49 cents on the dollar, plus charitable giving, plus allocations from local and state and federal, plus all the resources that people put in, plus all of the goodwill of clinicians who choose to stay in a public health system, you know, like you were speaking about before, Claire, around it's an active decision to commit to offering large scale healthcare versus, you know, being a self-profitable private practitioner. So there is a lot of value that gets put into a health system like ours. Whether you see it or not, somebody's paying a very, very, very big bill all the time. And it's, I think we're incredibly fortunate. You know, we had a health situation 2 weeks ago in New York, and despite my family connections and all the doctors waiving fees and doing whatever, the privilege of walking into the hospital was $5,000 US up front, you know, and it's just a different universe, and it's just what they're used to. And without health insurance, the whole system doesn't work, but somebody has to pay those bills. And so you have to be able to find the economic benefits to justify pretty much any activity you're taking, even and perhaps more especially if it's charitable. Yeah. Because there's a lot of scrutiny on the charities, as I imagine you feel every day, Jeremy, around somebody's given me this money, I better do the right thing with it.
Yeah, and I think just to add to that as well, it's exactly what you said, where someone's always paying in terms of if we do what we do through the charitable funds that we've raised, and also through a couple of other kind of revenue streams that we're just setting up so are a little bit more sustainable. But with the COVID flu vaccine outreach clinics, in some areas, the PHNs and the state government have contracted private immunisation services to do pretty much what we do, where they are going out and doing pop-up vaccine clinics in similar locations. But the only thing is that the PHNs and the state and Commonwealth kind of health departments are paying for that, whereas we were kind of doing it for free. And I think the delineating factor there was that when we started, we didn't have the capacity to say, oh, we've got 50 nurses. Let's call up the state government and say, hey, where do you want to send us? Where do you want to send those nurses today? So yeah, I think that there is both ways about it. Like, and that's something that we're definitely looking at in terms of moving forward. I think that definitely in the near term, we're going to stay how we're running. But if we were to go into this full time, then it would have to change up in terms of the scale. And yeah, I think that James is right. Economics and business underlies how health works, even if it is funded through a state or federal government.
Yeah, that's awesome. And it's been a really interesting discussion. I think like the one thing that sort of underlies all of this is data, right? So to see how feasible and all these different business models is, and what business model you should choose, what the outcomes would be. And I think data processing, especially in modeling in the healthcare system, would be vital. So I guess the next question would be directed towards you, Claire. In your research, how important do you think data is in the healthcare sector, and what can aspiring people wanting to get into the healthcare sector, what can these people do to sort of leverage this data to achieve the best outcomes for patients, but also just society and the healthcare workers themselves?
So when you say how can people leverage the data, what do you mean, like external people or
people within the system? So say like healthcare workers, how can they utilize data? What can be done to transform this data to make it more usable, to take a little bit of burden off themselves, but also achieve better outcomes?
Yeah, so you're really talking about digital transformation healthcare, which you know, until we had the digital platforms was impossible. So putting in the electronic medical records has been critical. We now have data that captures things such as every breath you take, every mil of urine you make, you know, and we can now extract that data and harness the compute power. So we now are harnessing that. We have machine learning and AI projects going on in predicting deterioration, predicting hypoglycemia, predicting febrile neutropenia. And the outputs of those models will change the way that decision support is provided to clinicians. So we really are seeing an absolute once in a generation shift in the way that data is used, not just for point of care, but aggregated and computed to provide decision support and better outcomes.
Yeah, and with the rise of personal medical devices and wearable technologies, do you see that this data could possibly be privatized? Like, say, for example, an Apple Watch can read an ECG. Do you think that it would ever go
Not at the
there?
moment. So our social license is not there. So privatization is a very difficult word because actually the consumers own their data.
Mm.
So it's fine if they want to sell it, that's totally fine. But I don't think that the government is going to privatize data because we simply don't have a social license for that. It's owned by our consumers. So if anyone wants to benefit, it probably should be them. Now, that doesn't stop ethically approved and governed uses of that data, as I've described, which are already occurring. I think there's absolutely no problem at all with using the data for ethically approved projects within the social license at the moment.
Yeah, awesome.
Selling data in, Vish, or using state data out? Are you talking about people being able to go to the hospital and say, hey, my Apple Watch told me I think I might be having a heart problem. Can you help me out, please? Are you talking about using health data and wearables to then connect with their health professional?
Yes, and sort of like as a preemptive case, have the Apple Watch just tell the hospital, for example, that this person is at risk of a heart attack without even notifying them first, to sort of, I guess, bypass consumers who might not necessarily trust the technology as much.
So the governance models aren't there for that at the moment. So you can't do, so we're starting. So we've got an Internet of Things stream of work going on at the moment where we're putting Garmin devices onto chronic respiratory patients at TCPH. And then we've got machine learning going on, looking at the blocks of data, trying to predict in advance, predict and prevent exacerbations of chronic lung disease. So that's a very rudimentary example. But that the governance around that is even tricky because you need to be resourced up to respond, right?
Yeah.
So we're still at baby steps, but absolute baby steps, trying to learn around data and how it flows. I mean, in my clinic, if someone comes in with 3,000 pages of Garmin steps, I don't have the capacity to look at them or make any sense out of them. And we don't yet have automated algorithms to speed that process up and provide decision support. So our 15-minute clinic appointments without any AI are geared up towards looking at a small book with some written numbers in it. So there's some structural changes that have to happen in healthcare delivery to allow consumption, interpretation, and analysis of large amounts of IoT or IOM. So we're getting there, but it's going to take some time and some structural changes. We're working on it, though.
We need more bioinformaticians.
Promulgate that without thinking through the structural issues, governance and response, right? So there's a whole pipeline of things that need to happen.
And yeah, thank you so much for that response. And I'm just a little bit aware of time. So I do think we'll be coming towards the end of this panel discussion, but I think it's going to be extremely valuable for the members who have been able to come and join us live, but also the members who will be watching this recording later on. So thank you so much, James, Claire, and Jeremy, for getting involved in this panel discussion, really helping inspire students into the innovation space or into the infrastructure space in digital health.
No problem. Thanks so much for having me. Bye.
Yes. See you, everyone.
Thanks so much, Vishaak.
Justin, there are a couple of books, mate, that you can have a look at, but in terms of numbers, I think it was interesting before, Vish, when you were saying, the health system can't change overnight. I think COVID's proven that as wrong as anyone could ever imagine. Right? Laws change, health systems change, rules change, effective change, quotients change immediately based on whatever you like. And so when you're looking at understanding commerce in health, I think it's far more important or interesting to understand how people think more so than what is the current financial system, because especially in Australia, it's so dependent on where you live and where you want to get that health care from, that it's hard to sort of wrap a bow around commerce in health. But there's a lot of really interesting books, and it's usually far more papers and interesting MBA style analysis of how different hospitals work from a commerce point of view. You know, if you look up Harvard Review, Mayo Clinic finances, you'll find hundreds of papers of people taking a look at how to get better financial outcomes while delivering a particularly unique health implementation. Like we looked at the financial viability of 3D printers, a whole bunch of other, if I want to implement this, what will happen financially? So there's it's lots more to do with papers than necessarily just, you know, finance in health. There's probably hundreds of books, but it's, aside from being a potentially interesting read, I think you're far more better off going and looking at how the health system you want to impact operates, as Claire was saying, so that you can then make some change within it. And you're far better off understanding human behavior than you are understanding any book specifically about a particular financial metric, because human behavior drives everything we do anyway. And if you want to make an outcome, you're far better off changing a way a system works than trying to understand the financial mechanisms of it, because you just get bogged down in way too much bullshit if you're looking at healthcare spending.
Yeah, awesome. Thanks for that, James and Jeremy. And we really look forward to getting you involved with our society in the future. So yeah, thanks so much for being part of this event. I'm 100% sure that all of our members would really love this event, even those who are unable to make it live to this event. And yeah, we really look forward to keeping a close connection with both of you.
Yeah.
That's great. Thanks, Vishaak. And lovely to hear you chat, James. Really appreciate it. And I think I learned a lot from that as well. So thanks.